Good morning. So, I haven't talked about healthcare in a while, but this came across my desk, and actually, I saw it on the nightly news on Monday. And it's a story I think you should all listen to. It really affected me. And if you think for 5 minutes that the state of healthcare in our country is in any way getting better, and when we heard everybody screaming how they wanted to keep Obamacare now, all of a sudden, they love it so much. Listen to this family story. These are hardworking people, a husband and a wife who get up every morning and go to work, and they pay their taxes, and they have beautiful children. A beautiful little girl who has diabetes and needs insulin to survive. She needs daily insulin. And because they work, they don't qualify for Medicaid or any freebies from the government. They purchase health insurance for their family. They take care of their children, of their responsibilities. So when their daughter needs insulin, they, of course, went to the pharmacy, got the insulin. Unfortunately, the insulin that their insurance company pays for, this little girl is severely allergic to. She can't use it. If she uses it, she could die. It would be kind of like your child's allergic to peanut butter, but the insurance company is providing a medication that has peanut oil in it. So the insulin that this child can use, that she's not allergic to, well, the health insurance company that they have their insurance with, that they pay premiums to, they don't cover that insulin. And the pharmaceutical company charges them $400 a month for this insulin, this life-saving drug, that if their daughter takes this drug every day as prescribed, she can live a normal life, a long life, a healthy life. But see, they can't afford $400 a month. Most of us wouldn't be able to. Not on top of paying health insurance premiums. Health insurance premiums that are supposed to cover the medication our children need to survive a chronic illness like diabetes. So here's what these people, these working people, these are not people who sit at home every day like some on welfare do and watch free cable or play on the free internet or have a free cell phone. These people get up every day and go to work to put food on the table, a roof over the head, clothes on the back, and needed medication for their children. That's what they do. They pay their health insurance premiums because the government told them they had to. It's mandated. They bought health insurance. So these people basically are now getting their daughter's medication from drug dealers. Yes. It's actually a black market drug exchange on the internet. I know. I shook my head. This is a very special episode of Shaking My Head. It's going to be Shaking My Head Thursday. I didn't believe it, but it's true. Basically, what they do is every month they go and fill their daughter's prescription that the health insurance will pay for the drug she can't use because she's allergic to it. And then what they do is they go on the internet and they set up a meet or whatever, and they basically exchange the drug she is allergic to with the drug she can actually use and survive and live another day. This is America. This is America today. Something to think about. Think about your beautiful children. And if they were sick and they required a medication and your health insurance said, well, yeah, we'll pay for it. And then you say, well, wait, my daughter's allergic to this medication. But there's a replacement medication. Oh, we don't care about that. We'll only pay for the one she's allergic to that she can't use. We don't give a shit. What do you think? Really? The reporter asked this woman, and by the way, what these people are doing is not illegal. It is not illegal to trade medications, apparently, or else they probably wouldn't have put their faces on nightly news. But they wanted the American people to know what's going on with the pharmaceutical companies and the healthcare companies, because they're both to blame and they both blame each other. But this reporter said to this mother, do you ever worry that the drugs you are getting on the black market may be tainted in some way? They might not be what you think they are. And this mother said, I do. I think about it all the time. But I don't have a choice. This is my daughter's life. I don't have $400 a month to pay the drug company. The health insurance company wrote me off. They don't care about my daughter, obviously, because they want to pay for a drug she is severe. They could kill her because of an anaphylactic shock, an allergic reaction. They don't care. And they have not reached out or tried to help me. And the drug company insists that the drug she can use costs $400 a month, and they won't budge on that either. And because we do have jobs, we do have JOBs, and we have health insurance, I can't go to Medicaid. I can't go to welfare and say, I can't afford my child's medication. What can you do for me? No one will help me. So I have to cross my fingers, exchange this medication every month, and hope that my daughter is getting what she needs so she can live. So she will wake up tomorrow morning. This is a little girl. She's little. She's going to need insulin for the rest of her life. What's going on here, guys? Hardworking, parents with jobs, has health insurance, can't get their child the insulin she needs to live. Think about that. It pisses me off whenever the healthcare debate comes up. And people say, we are so blessed to live in the United States. People come here to get cured because we have all the best drugs. We have all the best technology. We have the best surgeons, the best doctors. That's fucking awesome. That is shock and awe. That in the United States of America, we have the best. We can cure anything. As long as you're rich. As long as you can pay for it. You got the Fetty, you get the cure. You don't got the Fetty, you're 6 feet under. That's the way this country rocks. Sure, we've got awesome drugs out there that none of you will ever be able to use because it costs $4,000 a month to use it. That new MS drug that everybody was talking about. And it costs $60,000 a year to use it. It's like 2 shots a year, but it's $30,000 a shot. Oh, it's a breakthrough. Yeah, but for who? For who? Who the hell can afford to pay $60,000 a year for a drug? My God, I know heroin addicts who don't pay that much a year for their heroin. This is pathetic. And the reporters, they did ask, NBC News asked for they talked to the health insurance company. Do you have a comment? They talked to the drug company. Do you have a comment? Guess what? They blamed each other. The drug company said, talk to the health insurance company. The health insurance company said, it's not our fault. Talk to the drugs. Talk to the drug company. They're the ones charging the $400 a month for not hypoallergenic insulin. What? How about the fact that these parents are paying a monthly premium for health insurance that, by the way, now they can't really use? That they have to go fill a prescription every month for a drug they can't use so they can trade that drug on the black market for a drug that they can't afford, even with health insurance. What? It's amazing when you hear these hallelujah and kumbaya stories of people who have survived cancer because of these breakthrough drugs. People who have survived all kinds of illnesses, and it's a miracle thanks to the good doctors and the breakthrough drugs and the great hospital care. Who are these people? I bet they're not you. I know they're not going to be me, because I can't afford that kind of care. And I bet you can't either. You know, I love it when people say in this country we can diagnose illnesses earlier than ever, and people just have to come on in and get their free preventative screenings. Oh, great. I know I have an illness, but now I can't afford to take care of it because I don't have $4,000 a month. I don't have $60,000 a year for the best cures, for all this technology that we brag about as America. You know, oh yeah, if you're an Iraqi child and a soldier rescues you and brings you here, doctors in America will happily volunteer to do free surgery. They will volunteer to separate conjoined twins from another country. But they won't do it for Americans. This pisses me off. These Doctors Without Borders that are down in Costa Rica, American doctors who will charge you $250 for 10 minutes of their time, are going all over the world giving free care to foreign people in foreign lands. But if my husband walks into their office and has a chronic illness or needs surgery, they ain't going to volunteer nothing for him. A decorated Marine who is the breadwinner for his family. I don't hear any pharmaceutical company stepping up and saying, this little girl needs a certain type of insulin, her parents can't afford it, we're going to donate it. I mean, we only make $600 billion a year. You know, that's a blip on their radar to give this little girl the insulin she needs at an affordable price. Her parents aren't asking for it for free, but they can't afford $400 a month. The drug company can afford to lower the price of that drug. This little girl needs this drug the rest of her life. And the way she's getting it right now is from internet drug dealers. Even though her family has done everything right, they've played by the rules. They work, they pay for health insurance. What have they done wrong? What mistake did they make? Think about your children, your blessedly healthy children. Think about what happens tomorrow. If they wake up and they say, I don't feel so good, Mommy, and you take them to the doctor and they're diagnosed with something that requires daily medication for the rest of their lives. And if they have that medication, they will live a normal and healthy life. And then think about a health insurance company who never met your child, who you have paid premiums to, and they tell you, sorry, we don't cover that. You got to figure it out for yourself. Because we don't give a shit if your kid lives or dies. We just care about our bottom line. We have to pay bonuses out to our agents who are denying claims on an hourly basis. We have to give them their bonuses. We have to upgrade our offices, put a $500,000 statue in the lobby. That's from the movie Damaged Care, by the way, with Laura Dern. If you get a chance to ever see it, I strongly suggest you see it. Health insurance companies, my friends, are not doctors. And they are not your friends. And for all the commercials they put out there, you're not in good hands, and they don't give a shit whether you live or die. They only care that they collect more money from you than they pay to you. And the drug companies don't give a shit if you survive cancer or not. They only care that they get doctors to push their drugs, that you pay for them, that somebody's paying for them, so that they can give bonuses to their drug salesmen. who go to the doctors and offer free cruises and free dinners and all this perks that doctors get for prescribing drugs. How do you think pharmaceutical companies pay for those free cruises? Remember we talked about this, the perks that doctors get for prescribing prescription drugs. It starts out, you get a free pen. You get a pen with the pharmaceutical company's name on it. Then you might get a tablet of paper with their name on it. And then it starts getting, well, if you prescribe this many drugs to your patients and we see an increase, we'll send you and your wife on a Mexican cruise. We'll give you vouchers for nice restaurants. You can go out to dinner with your wife. Who do you think pays for that shit? You do. The parents of this beautiful little girl pay for it. Think about that. Think about American citizens getting their life-saving drugs that the pharmaceutical company makes. They make it. And the health insurance company has access to it. They just won't pay for it. So they get these drugs on the black market in America. In America. This is our healthcare, people. And for any of you who think everything's just dandy, that, oh, you get health insurance, that's all you need. My God, I am so every single day when I hear these kind of stories, I am so blessed that I don't have health insurance, that I'm not paying these motherfuckers to tell me I don't have a right to live. Because they ain't going to pay what they owe. They want to take my money, but boy, when I need them, they sure don't want to give it back. So yeah, I'm a very happy uninsured American citizen. Because this means that this American can go anywhere in the world if I get sick. And I can pay a fair price for a cure, or I can choose no cure at all. And we're going to be talking about that on Friday, tomorrow's show. A little bit. Tomorrow is going to be a kind of a dual show. There's two topics that I want to talk about. They're sort of connected and sort of just things that have been bugging me. But it's my show, so I get to mix it up a little. But yeah. So think about this story. Think about this family. It broke my heart, to be honest with you. And everybody out there thinks I hate kids and I'm very heartless when it comes to children. Oh, no, I'm not. And I always support parents who work hard to support their families and their children. And it is very hard living with and caring for a sick child. Bottom line is this little girl isn't that sick. She has a manageable illness. What she actually needs is the drugs that will manage her illness. Not the drugs that the non-doctors, that the health insurance company that never met her is willing to provide for her. They've been told she can't use them. They're a waste. And yet they continue to push them. This is what you get. We don't care if using it kills your daughter. This is all we have to offer. And now they're on the black market. And so far, so good. The drugs they got on the black market are working. But there could come a day when they get a bad batch of drugs. Just like when you go to any drug dealer. You don't know what you're getting. They don't know. But as this mother said, I have to take the risk because it's my daughter's life. If she doesn't use this insulin, she dies. And this is the only way I can get this type of insulin in America. First, do no harm. My ass. Political Paula, out.